in this video I'm going to show you how to measure an EKG, and it's a lot of fun to measure an EKG, but it takes a little practice. And so I'm going to start off by just sort of referring to an EKG. I have an EKG printout right here, an electrocardiogram. And this is what an electrocardiogram looks like. This is what we're going to be measuring. But I also have it blown up onto a larger piece of paper. I want to start off by talking about the ECG grid. This is a grid. And if maybe you can come a little bit closer, you'll notice in this grid that there are highlighted or dark red lines along with little tiny squares inside. You have there we go, nice and focused. You have the larger, you have the larger square, but then you have the little tiny squares inside. Let me just talk about that real quickly. Each little square represents a measurement, and then each large square represents a measurement. And so I'm going to go over here to the board and kind of explain that. So here we have an example of a large square with little squares inside. Now inside the large square are 5 little squares across and 5 little squares up. Okay? So we have 1, 2, 3, 4, 5 little squares, and then 1, 2, 3, 4, 5 little squares up, for a total of 25 boxes in a large box. Okay? So again, this is a large box with little squares in it. Now on the EKG tracing, anything that goes across the horizontal plane, in other words, across this direction, represents time. Okay? So anything moving in that direction represents, all the little boxes in that direction represent time. And all the little boxes that go up or down represents amplitude. In other words, electricity. Okay? So coming back to this grid, all of the boxes in this direction represent time, and anything going up or down represents amplitude. Okay? So if you can just remember that, it's just real simple, and it'll probably make more sense as we go along. All right, so let's now talk about some math related to these little boxes. Along the horizontal plane, or time, every little box equals 0.04 seconds, 4/100ths of a second. So each little tiny box is worth 0.04 seconds. That's a very small amount of time. But of course, an EKG goes down the horizontal plane, and several seconds can occur. Each little box up represents 1 millivolt. So you can see that one little box is 5 millivolts high. Okay, so that's just some math to consider. I just want to kind of set that up. Let's do that again. Each little box is equal to 0.04 seconds. So you have 0.04 seconds in this little box, 0.04 seconds in this little box, 0.04 seconds in this one and this one. They all represent 0.04 seconds. Let's do some math. If you were to add up the seconds for all of the boxes in a large box, all of the little boxes in a large box, you would just simply say 0.04 times, let's do this, times 5. 5 boxes, 1, 2, 3, 4, 5 times 0.04 would equal, 5 times 4 is 20. 5 times 0 is 0 plus the 2. And so bring our decimal point over. So we have 0.20 seconds. So 5 little boxes equals 0.20 seconds. All we did was we took 0.04 for each little box, multiplied it by 5 little boxes, which is a total of 0.20 seconds, or 2/10ths of a second. That's only 2/10ths of a second, very small amount of time. So one large box is equal to 0.20 seconds, 2/10ths of a second. But each little box represents 0.04 seconds. It takes sometimes time to sort of get that to solidify in your mind. Please feel free to ask questions. I know that sometimes when you start talking math, people get turned a little sideways, which is understandable. But I need you to understand that basic concept of time. Now, every little box upward represents millivolts, and so that's real simple. 5 little boxes in a large square up is 5 millivolts. Okay, so that's real easy. When you're running an EKG, I'm going to change this. When you're running an EKG, you're going to notice that the EKG tracing traces across. That represents time. But you can see that there are upward deflections. You can see there's an upward deflection there, and sometimes there are downward deflections. So as the EKG is tracking across this line, it represents time, how long it's taking for the heart to contract and relax. And then every time you see an upward and a downward deflection, that represents the electricity being discharged by the heart's muscle. Okay? So I'd like to do a really quick exercise in how to measure an EKG. In class, we already spoke about the cardiac cycle. Real quickly, I'll just draw this. Remember, the cardiac cycle represents a P wave, Q, R, and an S. Okay, so this is your P wave, Q, R, S down here, along with a T wave. Okay, so this is your cardiac cycle, one cardiac cycle. And if you look really closely, you can see over here in this lead 2 at the very bottom, this is your lead 2, you can see your P wave. Then right there at the corner is your Q, up here is your R, this corner down here is your S, and then followed by a T. Going again, we have another P, Q, R, S, and then another T wave. What people tend to do is they get confused as they see this, maybe this T wave from a previous cardiac cycle, and they automatically think that it is the P wave. But remember, the P wave always comes right before the QRS complex. Now in this particular complex, you can see that the Q didn't go down. That's okay, but it's right there at that corner where the Q wave represents. The R goes up, and the S didn't come down like I showed you on the board, but it came down just a small amount. That corner still represents your S. So let me go over here to the board. Not all cardiac cycles are going to look like this. In fact, on the EKG that I just showed you, it looks like this. Okay, this is still your P. Right here at this corner is your Q, R, S, followed by the T wave. Okay, so don't expect them all to look like this. Sometimes they look like that. That's okay. That's not a problem. Remember that the EKG tracing is taking a picture of the heart's electrical activity from many different angles. Sometimes you're going to have an angle where you get very prominent deflections that look like this, and sometimes they're going to be very weak deflections because of the angle of the picture, just really depending on where you're recording the heart's electrical activity. Okay, so let's do some quick measurements. You have a handout that tells you how to measure your P wave, okay? Your P wave. Remember, it says to measure from the beginning of the P wave to the ending of the P wave. In other words, where the baseline, remember, is that imaginary line that goes across the tracing. And so we're going to start right at the baseline where the P wave starts to raise up, moves across, and then returns to the baseline. So maybe I should move that out just a little bit farther. Okay? Okay, so you want to be able to measure directly from where it began and where it ended. So we're going to go back over here, and I'm going to show you real quickly how to do that. You're going to take your calipers, and you're simply going to measure from the beginning of your P wave to the end of the P wave. Make sure you get those points real close. Now what I want you to do at this point to measure the exact location is that I want you to take your calipers somewhere above it or below it where there's no electrical activity, and I want you to place one of the points of the pins, the caliper pin, on the beginning of a strong or a heavy line, and then let the other pin just sort of, or point just sort of land where it does. And you'll notice that the P wave is exactly 2 small squares across. That's the distance of the P wave. Okay, so let's go do the math on the board. To do this, you're going to say that the P wave represented 2 small blocks, or two small squares, I should say, two small squares. So we had two small squares times 0.04, because remember, each small square represents 0.04 seconds. So we'll just do the math. 2 times 4 is 8. 2 times 0 is 0. So we have we have 0.8. We have to bring our decimal point over 2 places from the left. 2 places right over to the left. And so we put our decimal point there. And so the P wave equals 0.08 seconds. Okay? So that's how you measure that. It's real simple. 0.0 seconds, because there were two small squares. That's how you measure your P wave. Now the trick here, and I hope you catch this, the trick here is to make sure on your bottom lead 2, we call it the rhythm strip, is that you ensure that all of your P waves are exactly the same length. So take your calipers, where you actually set them to measure the first one, and go down the line and measure all of your P waves to make sure that they all measure exactly that 0.08 seconds, or those two small squares. If you find that you have a P wave outside of those two measurements, then you want to make sure to catch that. That would indicate some type of an arrhythmia in the atrium, and we want to make sure that we don't overlook that. Okay? So measuring the P wave is real simple. You simply take your calipers, you measure from the beginning of a P wave to the end of a P wave, and then measure what that distance is somewhere on your EKG paper, and then multiply those small squares by 0.04. Very easy to do. Most P waves should be curved. They should be, don't get excited if they're not curved. Sometimes they're peaked, but most of them are curved, and they represent the contraction of the atrial muscle. Okay? So the next measurement is going to be what we call the PR interval. The PR interval. Okay? And the PR interval measures from the beginning of the P wave, just like we measured the P wave, to the beginning of the QRS complex. Okay, so we're going to be measuring from here all the way to there, just before that Q wave begins to move away from the baseline. Okay, so we're going to take our calipers and we're going to measure those 2 points. So come on over here and we'll measure that real quickly. Okay, so we're going to take our calipers and we're going to measure from the beginning of the P wave all the way to where the baseline ends and the beginning of that QRS complex. So you can see that we're exactly at those 2 points. Try to get them right at that point where the P begins to go up and the QRS complex, also the Q begins to form. Okay, it's those 2 points. We're going to then move away from there, and we're going to find a clear, unmarked area of the EKG grid, and we're going to just measure. And you can see that there are 3 boxes between those 2 points, 3 boxes. Let's go over here and do our math. So we say that the QRS complex is 3 boxes wide. You guys, this is not that hard. 3 boxes wide, or 3 squares, I keep saying boxes, 3 squares, 3 small squares, times 0.04 seconds. 3 times 4 is 12. And we'll bring our decimal point over. And so the PR interval equals 0.12 seconds. Okay? Now remember, we're going to not only measure the first PR interval, but we want to make sure that all of the following or all of the subsequent PR intervals are also the same measurement. It is very possible for someone's heart to change due to some kind of disorder or condition of the heart, to change the PR interval, and we want to be able to catch that. Okay? So again, not very difficult. Just knowing where you're going to begin, where your beginning point is, and where your ending point is for the PR interval is so easy. If you're not sure, just ask. But if you're not sure and you're guessing, you're going to get the wrong measurement. Okay? So we've done the P wave, the PR interval. Now we're going to measure the QRS complex. The QRS complex is also very easy because it's just the beginning of this QRS complex to the very end. Okay? So we're just measuring those 2 points. We're measuring this huge deflection here. Remember that that represents the contraction of the ventricles. So we're going to take our caliper and we're just going to measure exactly where that QRS complex began to form, all the way to where it begins, where it ended. Okay? So essentially we're measuring from the baseline, where the QRS complex begins, to where it actually returns to the baseline again. We're going to move this up here. We can see that there are exactly 2 small squares, and we're going to do our math. Remember that each small square represents 0.04 seconds, and so it's 2 small squares for a total of 0.08 seconds. So our QRS complex is equal to 0.08 seconds. Okay? Again, go down the line and make sure that all of your QRS complexes measure the same. Again, it's very possible for someone to have an extra wide QRS complex somewhere down the line. We don't want to miss that. Okay? Something you definitely would want to point out to the doctor. So we've done the P wave, the PR interval, the QRS complex. Not a lot of math, not very difficult. You will have a handout, or you should have a handout that also explains this to you. All right, the next measurement is called the ST segment. ST segment. Okay? And it's just a section from where the S ends, where it returns to the baseline, just to before the T wave begins to form. So we call that the ST segment. Whoop, let me just kind of move this right there. Let's do it this way. Okay? It's right between this point and that point. That's the ST segment. We're talking about a section. Now, we don't actually measure with the calipers the ST segment. All we're doing is looking at it. And this is very simple to do. There's no math involved. It's just an evaluation of the ST segment. So let's kind of go over here, and I want to talk about that. The ST segment is considered normal if it actually begins at the baseline. A lot of times these ST segments start at the baseline and then they begin to elevate somewhat. That's not a problem as long as it began at the baseline. Okay, so we're going to look at it. We're going to say, yes, it begins at this baseline. That's an imaginary line that goes all the way through. It begins at the baseline. It tends to sort of go up a little bit before it actually begins to start forming the T wave. Now, if it begins at the baseline, it's considered normal. Okay, so the ST segment is normal if it begins where? At the baseline. Okay, so you're just looking at that. And if it does begin at the baseline, you're simply going to say ST segment is normal. Remember in class, if it's elevated, if the ST segment does something like this, where it comes all the way up to the baseline, passes the baseline, and then starts to form your T wave, then we say that it is elevated. An elevated ST segment. In fact, in the hospital we call that a STEMI, which means ST elevation myocardial infarction, which is the patient comes in with chest pain and they have an elevated ST segment. There's a good chance that the patient is having a myocardial infarction or a heart attack. So it's important that you take a look at it. If you're running an EKG on a patient and they're telling you they're having chest pain and you see this ST elevation, that's something I'd probably want to let the doctor know about right away. In fact, I would run the EKG and I'd say, take it to the doctor and I'd say, I have some ST elevation here, doctor. Patient's complaining of chest pain. I'm sure the doctor would appreciate you telling him that. Okay? So remember, no math. We're just evaluating the appearance of that ST segment. Is it elevated? Something of interest, if your ST segment is not elevated, in fact, if it's depressed like this, where it doesn't actually reach the baseline, it actually stops short of the baseline, forms the T wave, then we call that ST depression. ST depression. Now, an ST depression is actually an indication of an old heart attack. And so, again, we want to be able to see this. If it's elevated, depressed, or if it's normal. Remember, it's normal if it begins at the baseline. And if a person, I had a young gentleman who was 18 years old who actually had these depressed ST segments, 18 years old. And I kept noticing that, and I said, hey, have you ever had a heart attack? And he says, yes, I've had several in the past. I used to use drugs. And it was very indicative to me that, this was very apparent to me that this kid had had a heart attack already in his life. All right, the last thing that we're going to be measuring, real simple, is what we call the QT segment. The QT segment. This is going to be the largest measurement that you're going to have in your EKG tracing. And it begins right here at the beginning of your QRS complex, and it ends all the way at the end of the T wave. We call this the QT segment. The QT segment. Beginning of the beginning of the QRS complex, so the Q is right here, and the end of the T wave. Largest measurement you're going to find. And so if you'll come over here, I'll show you exactly where we're going to measure this. We're going to go back to our EKG tracing. You can see the beginning of this QRS complex all the way over here to the end of the T wave. It's a long measurement, okay, all the way to the end. Make sure your points are exactly at the right place. I'm going to move it up here, and you'll see that it actually goes from the beginning of that square just to one small square before the end of the second square. So remember, there's 5 blocks per